Greetings all. Tim McGowan here with a COVID update for you. I know there's a lot of buzz out there, so I want to give you the number straight from the horse's mouth, so to speak. So, staff, I'll start with staff. So as of today, at this moment, we have 22 staff in the entire company who are out with COVID. So by Sunday, that number drops to 4. So 18 of those folks can come back to work starting on Monday. So that really takes us back to almost full strength. So there will only be 4 people out as of Monday. And remember that we're now using the new CDC guidelines. So the way that works, if you have signs or symptoms of COVID or you test positive, from the day your symptoms start or the day you test positive, each one of those is considered day 0. 5 days after that date, you can return to work as long as you're fever-free for 24 hours or your symptoms are resolving. So if 5 days after you've tested positive, if I test positive today, within 5 days, if I'm feeling fine, I don't have a fever, I can come back to work. And really that's going to help the workforce, not only with Maple Knoll and the Knolls, but in general. You're seeing that happening in hospitals. The way staffing is right now, we just need people to get back. The CDC has determined that after day 5, you're not infectious. The other thing to note is there's not a requirement for a negative test after that 5-day period to come back. You simply come back. Because if you took another PCR test, you're going to test positive. So you don't need to take that other test to come back. When it comes to testing, if you have been positive and you do not need to test then for the next 90 days. So if you tested positive last week, you don't have to test again for another 3 months. I'm in that boat right now. I don't start testing till the middle of January, based on when I had it. So when you do come back after that 5 days, no matter where you work, you just need to be in an N95. So if you're in IL, AL, SNF's already in the N95s, but if you, down at Maple Knoll, but if you come back in any other area for the next 5 days, wear that N95. Then after that, you can go back to a surgical mask if you're in AL or IL. Some of this may sound a little confusing. If it is, call me. My extension is 7980. Or call Aaron or Karen. I have to put on my spectacles, make sure I don't miss anything. When we are doing the testing, only come in if you're required to test for work. So if we're in outbreak testing and everybody's required to test, come. If you're on the unvaccinated day and you need to test, come. Don't come in just to show up and say, hey, I have a family function this weekend, I want to make sure I'm not positive. We don't have the resources to be doing that at all. So we're only testing people as we require them to be tested for work. Hope you can appreciate that. Current residents who have COVID. So at Maple Knoll, we currently have 2 in the assisted living who are positive. We have multiple people in IL, and there's more every day, it seems like. It's still not a lot, but there are more than we want. And when things like that happen, housekeeping and maintenance are made aware so that they don't go into the IL units. We have to make nursing aware because people are answering pendant calls. They have to know that they have to go in full PPE. We also have to alert EMS so that we have to know, so if there's an EMS call, they need to know that the person they're going to has COVID and they have to be in full PPE. So many reasons for all the notifications of what we need to do. I can tell you that and then in Bodmin, we have currently 11 people in Bodmin with COVID. And that's at Maple Knoll. At the Knolls of Oxford, we currently have 0 residents in any level of care, which is fantastic. In terms of Bodmin, yes, we have 11 folks and we are cohorting them. They're all on the 4th floor. There's one on the 2nd floor who comes out of isolation tomorrow. And the others are all on the 4th floor. We're using that as a cohort area. Those folks are not showing severe symptoms. I just checked the notes on one. No shortness of breath, no fever. We are very lucky that we are vaccinated and boosted with those residents. Very lucky. There are other nursing facilities still struggling to get boosters for their residents. Erin did a phenomenal job on getting everyone boosted to protect them. The vaccine and the booster are not going to stop you from getting this, but they are going to stop you from getting severely ill or potentially dying. We had one resident at Maple Knoll who got this and did pass away, but that person had tremendous number of comorbidities that contributed to that. Those who are not immunocompromised and don't have a lot of comorbidities are going to be statistically going to be fine if they've been vaccinated and boosted. So staff out there who haven't been boosted yet, if you're eligible, please get your booster. The other question has been visitation. So the Ohio Department of Health and the governor have made it very clear that nursing homes cannot stop visitation. The guidelines are very clear that you will allow visitation, period. If we get to a percentage of more than 1/3 of our residents, we can restrict it. We're nowhere near that at this point. So we are doing exactly what ODH says that we need to do by allowing visitation to continue. This has been questioned now by the governor's office and through the Ohio Department of Aging. They called me yesterday to question whether we were allowing visitation. I confirmed that we were, and they said, you're doing the right thing. That's what you're supposed to do. And so it's been confirmed at the state level. So those of you out there who are still questioning why we haven't shut it down, that's why. We're right within the regulation. We can't at this point. When we are able to and we need to, we will. In terms of staffing, just know that we have contingency plans in place. We're looking to, if you remember back in the early part of the pandemic, we redeployed people as we shut things down. We're about in that mode right now. We're pulling people from different departments into other departments. You know, you'll see people working the floor in Bodmin who aren't necessarily aides in their given job. So others are all pitching in. We all have to pitch in different places, whether it's transporting people to dinner, whether it's, you know, at the Knolls, we've got people in the dining rooms serving it every day at lunch who aren't in nursing or food service. We have people transporting in Breese Manor to help out the PCAs and the nurses over there. We have, you know, Laura and Cordacia and different people working the floors in Bodmin to help out the aides there. We're all trying to pitch in where we can. We have Brianna's interviewing like crazy. Applications are on the uptick, which is fantastic. We are interviewing and getting people onboarded as quickly as we can. Beth has worked hard to up wages so that we can attract people. We're doing as much as we think we possibly can. I can tell you it's incredibly difficult just to even get people to return phone calls. I put out calls over a week ago to 6 nurses, and I'm talking nurses, LPNs and RNs. And guess how many phone calls I've gotten in return, or emails, because I do both. I call them and I email them. How many have I gotten a return from? 0. So when we get people, we need to take advantage of them as quickly as possible and get them in the system. And when we do, everybody out there needs to welcome them with open arms, because the more help we have, the less of a burden on you. I want to specifically thank everybody out there who shows up on time when they're scheduled to work. Thank you. Anybody who shows up when they're scheduled to work and they're on time and they pick up extra to help out, humongous thank you, huge thank you. This is a group effort and we will get through this together. I know that. We're almost 2 years into this and we're still here. There are places out there folding up, businesses shutting down. We don't have that luxury because we have residents to take care of. And I can tell you that residents almost on a daily basis tell me, thank you for everything you've done to keep us healthy and happy. Not me. You meaning everyone that works for Maple Knoll Communities whether it's at Maple Knoll Village or the Knolls of Oxford. They are very grateful for what we are doing, for what you are doing, as am I. So please hang in there. There is a light at the end of the tunnel, and it is not a train. We will make this, and we will get through it, and we will get through it together. So thank you very much, and I'll talk to you again soon.